So good morning. Let's learn about congenital adrenal hyperplasia. So these are a group of autosomal recessive disorders. So there are 4 enzyme deficiencies in congenital adrenal hyperplasia. So one is 21 hydroxylase deficiency, which is the most common type. 90% cases there is increased testosterone in these cases. And second is 11 beta hydroxylase deficiency, which is the second most common type, and which are 4%. And 17 alpha hydroxylase deficiency means there is increased aldosterone, and 3 beta HSD deficiency there is increased DHEA. So in congenital adrenal hyperplasia, how do you choose the options based on the MCQ options? So first is you have to find out if it's a salt wasting crisis. How do you find out if it's a salt wasting crisis? In salt wasting crisis, there is deficiency of mineralocorticoids. The patient is going to present with shock, hypertension, hyponatremia, and hyperkalemia. So this is going to happen only in 2 conditions. One is 21 and the other is 3. Just remember 21 and 3 for salt wasting crisis. 21 hydroxylase deficiency and 3 beta HSD. In case of salt retaining crisis, there is excess of mineralocorticoids. So the patient is going to present with hypertension, hyponatremia, and hyperkalemia. The first number is going to start with 1. It can be 11 beta or 17 alpha. 11 beta hydroxylase deficiency, 17 alpha hydroxylase deficiency. So you can also choose the options based on the genitalia. In male cases, ambiguous genitalia is only produced by 17 alpha hydroxylase deficiency and 3 beta HSD. Normal genitalia is produced by 21 hydroxylase and 11 beta. In female cases, normal genitalia is produced by 17 alpha and ambiguous genitalia is produced by 21 hydroxylase, 11 beta hydroxylase, and 3 beta HSD. Just remember 17 normal is only for 17 alpha for females. Rest all the enzymes are ambiguous genitalia for females. In males, ambiguous genitalia is produced by 17 alpha, 3 beta HSD. So the one which is going to end, so you can just remember the one which is going to end with 1 going to produce a normal genitalia in males. So in females, just remember 17 alpha normal genitalia, all the other enzymes ambiguous genitalia. In males, the one which is going to end with 1 is going to give a normal genitalia. So 21 and 11. So I already told you the one which is going to start with 1 salt retaining crisis. The one which is going to end with 1 normal genitalia in males. So let's look at the flow chart. Just before that, the screening test is done using the dried blood spot. You'll have to check for serum 17 hydroxyprogesterone levels. If it's elevated, it's a 21 hydroxylase deficiency, and the drug of choice for that is hydrocort. For salt wasting crisis, you have to add fluorocortisone because it's a synthetic mineralocorticoid. First, let's look at the flowchart. Zona glomerulosa, fasciculata, and reticularis. These are the layers of adrenal cortex. In zona glomerulosa, the cholesterol is converted into pregnenolone with the help of side chain cleavaging enzyme. Pregnenolone is converted into progesterone. Progesterone to 11-deoxycortisone with the help of 21 hydroxylase. Very important enzyme. 11-deoxycortisone to corticosterone. 11-beta hydroxylase. Corticosterone to aldosterone. So cholesterol, pregnenolone, progesterone, 11-deoxycorticosterone, corticosterone, aldosterone. So pregnenolone is converted into 17 hydroxypregnenolone with the help of 17 alpha hydroxylase. Similarly, progesterone is converted into 17 hydroxyprogesterone with the help of 17 alpha hydroxylase. So this is going to happen in zona fasciculata. And again, 17 hydroxypregnenolone is converted into 17 hydroxyprogesterone. 17 hydroxyprogesterone is converted into 11-deoxycortisol. 11-deoxycortisol to cortisol. 17 hydroxyprogesterone is converted into 11-deoxycortisol with the help of 21 hydroxylase. 11-deoxycortisol to cortisol. 11-beta hydroxylase. So again, in reticularis, what happens is 17 hydroxyprogesterone and the progesterone, pregnenolone and the progesterone, they are converted into dehydroepiandrosterone, which is actually DHEA, and here it is converted into androstenedione with the help of 1720 ligase. So this androstenedione in the peripheral tissues is converted into testosterone. So this flowchart is specifically done for 21 hydroxylase deficiency. So in 21 hydroxylase deficiency, since there is 21 hydroxylase is deficient, aldo cannot be produced. There is decreased mineralocorticoids. So in 21 hydroxylase deficiency, aldo cannot be produced. There is a decreased low aldosterone. In 21 hydroxylase deficiency, cortisol cannot be produced. A decreased cortisol. There is decreased cortisol and aldosterone in 21 hydroxylase deficiency. In 21 hydroxylase deficiency, everything is converted with the help of 1720 ligase into androstenedione. In the peripheral tissues, they converted to testosterone. So increased testosterone, increased androstenedione in females. So that's the reason in 21 hydroxylase deficiency, there is ambiguous genitalia in females with the help because there is increased testosterone. whereas in males the genitalia is normal for 21 hydroxylase deficiency. And let's look at the second enzyme, which is as I told you, 21 hydroxylase deficiency is the most common congenital adrenal hyperplasia. The next is 11 beta hydroxylase deficiency. In 11 beta hydroxylase deficiency, 11 deoxycorticosterone cannot be converted into corticosterone, so there is elevated 11 deoxycorticosterone levels, and again aldosterone cannot be produced, there is decreased aldo. And in 11 beta hydroxylase deficiency, 11 deoxycortisol is elevated, cortisol is not produced, there is decreased glucocorticoids. And again everything is converted into dihydroepiandrosterone, androstenedione and androsterone, so decreased testosterone, there is androgens. So that's the reason in 11 beta hydroxylase deficiency there is increased testosterone, ambiguous genitalia in females, the normal genitalia in males. And finally 3 beta hydroxy HSD deficiency. So 3 beta HSD deficiency is actually giving rise to increased DHA is produced, and there is increased 17 hydroxypregnenolone.